We wait for the little spinning light to turn solid. Hi everybody, it's Friday. That means the doctor is in. TOA is live. I'm actually a living person. I'm Gray Stahlman, I'm your host. Thanks for being here. For those of you who've been with us from episode to episode, thanks for sticking with us. For those of you who've never seen me before, this venue is something that we put together to try to help you understand the musculoskeletal system, what we do for a living as far as trying to help people with the musculoskeletal system at TOA. Tennessee Orthopedic Alliance is the largest, oldest musculoskeletal practice in the state, certainly in the mid-state. Our offices span from Knoxville to Columbia. We've been here since 1927 in one various form or another, and we continue to try to help everybody from southern Kentucky, northern Alabama, eastern Tennessee, western Tennessee with their musculoskeletal needs. So if you need to know something about bone, muscle, joint, nerve problems, go to TOA.com. There's a host of information there regarding our facilities, our locations, our services at various facilities, our practitioners, including the doctors and the PAs and nurse practitioners. We have a huge section of media that is primarily video content for information on various topics and other little fun things. I think you can find information that you need to try to help you get yourself in the game, back on the field, back to life, trying to get living better and stronger. So TOA.com is your resource. As always, I just wanted to preface this talk today with this disclaimer. I'm an orthopedic surgeon. I'm a fellowship trained spine surgeon, but I'm not your orthopedic surgeon. This is not official medical advice or information. It's merely my opinion, based in fact, maybe with a little bit of poetic license here and there, but I'm not giving you medical advice. If you have a medical problem, seek out medical care, okay? This is really for information and education and maybe a little entertainment purposes. So as you can see today, Kevin and I are by ourselves. Well, Casey's here, but Kevin and I are by ourselves and no guest today. And I wanted to, I prefaced this episode a few weeks ago with a little teaser about Dr. Death, and I suggested that people go look up Dr. Death and find out what we're talking about. For those of you who don't know about Dr. Death, I'll tell you a little bit about this story, which is rather frightening. But the main topic, the main purpose of this episode is to help you understand that a Dr. Death is an extraordinarily rare experience. That's not what healthcare is all about, okay? And I want to try to alleviate some fear and anxiety that people may have and maybe educate you a little bit about how to find a caregiver, especially in my world, spine care, that is trustworthy, well-educated, well-trained, and good at what they do. So I'm not going to specifically talk about spine, although the story of Dr. Death is all about spine, so it's near and dear to my heart. It really is something that should help anybody who's looking at specialty care in our situation, musculoskeletal care, to help reassure you about the quality of care that you're going to receive, okay? So this is the deal. Dr. Death is a real event. Dr. Death, the term, came out of a podcast that was put together on a production company called Wondery, and the narrator was also the author of the story, and it was a reporter in Texas regarding a spine surgeon, a neurosurgically trained spine surgeon in Texas named Christopher Dunch. Now, this happened a few years ago. Again, while it's hard to believe, this is real. This happened. And the big deal with Dr. Dunch was that he was one of the first physicians ever convicted in court of a felony murder charge for essentially malpractice. Now, part of that had to do with some tweaks in the law in Texas that allowed the prosecutors to go after somebody treating an elderly patient and having a complication of death. But this is a story of a spine surgeon who hurt people. Now, Dr. Dunch trained, we have a Tennessee connection. He grew up in Memphis for a period of time. He trained at UT Memphis Medical School. He did his residency in neurosurgery at UT Memphis and did a fellowship at the Sims Murphy Clinic, again in Western Tennessee. Highly regarded programs, both of them. He made it through and started practice in Texas. This was at a time when spine surgeons were considered premier caregivers and, frankly, high profitability surgeons for facilities. So spine surgeons have been in need. Spine surgeons are not very common. Spine surgeons make the hospitals a lot of money. So he was invited and started practice in Texas doing spine surgery. Unfortunately, little did the administrators know that he was a sick individual. It's clear after the fact that Dr. Dunch is narcissistic, he's a sociopath, and he has no regard for the state of his patients. Literally, he did 38 cases, and 35 of those cases had either a death or a major complication such as being paralyzed, organ damage, required further surgery, etc. Now, before I go on further, every surgeon has complications. Complications are part of doing surgery. Mistakes happen as well. We can do the wrong space, we can do the wrong side, we can do the wrong operation. It can happen. We're human beings. What we try to do, however, is minimize the chance that complications occur, and if they do occur, we address them and try to manage them, okay? The only, as I've told my patients, the only way to absolutely avoid complications associated with surgery, especially spine surgery, is not have surgery. It's just a fact. There is no risk-free surgical procedure. Now, most of the time, complications or risks happen very infrequently or don't create a substantial problem. But as surgery complexity goes up, so working on the heart, on the brain, on the spine, complication rates go up, and risks, the actual consequence of the complications go up as well. So again, we cannot avoid risk unless we don't have surgery, okay? But the problem with Dr. Dunch was that it seemed very clear that he had no idea what he was doing. His skills were terrible. And he had no real concept that he was causing people harm by his actions. Essentially, everything that happened to these people was explained away as a patient problem or an anesthesia problem or something else. It was never him. Well, that's the sign of a narcissist. A narcissist is a person who basically believes the world revolves around them, they can do no wrong, and they're all-knowing. That's a bad trait to have if you're a surgeon. Now, most surgeons are fairly confident. You have to be confident to be able to cut open somebody. You have to be pretty arrogant in some regards to put up with complications and be able to deal with them. You have to be a problem solver. But narcissists feel that they're untouchable. and not responsible. And that's a big problem. He was also sociopathic, meaning it didn't bother him, apparently, that these complications were occurring. So this went on, and a group of physicians in the hospitals that he flitted around to ultimately brought him to justice with the help of the prosecutors. That's about all we're going to talk about Dr. Death, okay? It's a scary proposition. And go to Wondery, Dr. Death, the podcast, or Peacock, the streaming NBC network, did a docudrama series called Dr. Death that I've seen some of the episodes, and it's pretty good. The podcast is outstanding. The reporter, the author, did a tremendously good job of being as accurate as possible. And frankly, it was all the rage for everybody in my world, the operating room and whatnot, to listen to this because it's very sobering, frightening, and frankly, it made me sick to my stomach to think that somebody like this could be out there doing what I do, harming people. So it really brings up two questions, and I'm going to transition into how we go about understanding how to avoid a Dr. Death, which I've never seen anybody like that in my entire career, or somebody that's more realistically just not that good. It brings up two questions with regard to healthcare in general that I just want you to ponder. How in the world did a system that's designed to try to train people to help people with quality and compassion, how in the world did somebody get through this system to get to where he was? Literally think about it. He passed through every milestone, college, medical school, residency, fellowship, and was passed on seemingly in good graces. Well, it turns out that he was inadequately trained and nobody stopped him from progressing along. There are a lot of reasons why that occurred. Various opinions abound. Nobody's really owned up to that. But I will tell you that it does point to some challenges within the healthcare system. It is really hard with the system that we have to get rid of bad doctors. There's a lot of hoops and challenges that various reviewing bodies, etc., have to go through in order to get rid of a doctor's license. It's unfortunate. I understand the history of why that is, because physicians were essentially held to a higher level of standard and have been given a lot of leeway in that. But it is, honestly, very hard to get rid of really bad doctors. Why? That's mind-blowing to me, but it is true. So the system failed everybody in this situation. Dr. Dunch failed everybody in this situation, but part of his situation, he didn't understand, or he didn't realize, as far as I can tell, that he was a menace to society. Unfortunately, that's what sociopathics people are. Narcissists are. They don't realize that they are a menace or a problem. So that's a big one. That's a big question that I think every physician who listens to this type of story has to think long and hard about. We need to do a better job of policing our world, our community of physicians. We need to hold ourselves to the highest ethical standards that we can. Anyway, so that's an aside. So the reason why I kind of thought about this topic was I had a conversation with one of my partners who's a spine physician, and he'd been seeing a patient, evaluating a patient, talking to the patient, and finally decided to recommend surgery for that patient. And my partner was rather taken aback when the patient said, "Oh, I don't want to have surgery." Here he is talking to the surgeon who's proposing the surgery. "I don't want to have surgery. I heard that Dr. Death story, and I don't want that to happen to me." Well, think about it. He's talking to the surgeon that So he's kind of insulting the surgeon, although the patient didn't mean to. But it really got me thinking that people who've heard this story look at that and say, well, that's must be the norm. There must be lots of doctor deaths out there, and therefore it's really risky. Well, I'm going to tell you there are not. Okay, that's an extreme. There are bad doctors, yes. They're just like there are bad plumbers or bus drivers or sanitation workers. There's a whole variety of levels of capability, skill, compassion, training, etc. But by and large, what we have to go through, the hoops that we jump through to get to the point where we're allowed to operate on somebody and treat patients is pretty rigorous. I go through 4 years of college. I have to pass college. I have to pass the test to get into medical school. That's called the MCAT. I have to pass through medical school and do all the various coursework and clinical stuff to get through medical school. And then I have to get accepted into a residency program, which in the orthopedic world is a 5-year program typically. I have to pass through every rotation of of residency and do that satisfactorily. And then I was accepted into a fellowship program, which is another year of training. So I had 6 years of training after medical school and passed that. By and large, the people who are failures in those various processes get weeded out. Okay? By and large. There are some people who finish all those processes and then move on to non-clinical care. Some people choose to do that. They recognize it in themselves that it's not for them to take care of patients. So the vast majority of people out there who are operating on people are qualified and by that time are dedicated to it. So what can you do to try to help vet that, to try to determine for yourself that this surgeon who's proposing this operation for you is good enough for you, okay? Well, there's no easy repository. There's not a database that tells us, oh, he's an A+ surgeon and he's a B surgeon and he's a C surgeon. However, one of the biggest databases for people to utilize is friends and family, okay? You can do your due diligence and look at a person's training and say, well, he went to, for example, I went to Vanderbilt, a top-notch medical school. I did my residency at Vanderbilt, a top-notch orthopedic residency. I did my fellowship with an outstanding group of surgeons in Charlotte, North Carolina. You can look at those and decide for yourself, okay, there's at least a minimum qualification there. But that doesn't really tell you how they are day to day. Family and friends can be a really good resource to talk to people about their experiences with that surgeon or this surgeon and how it went. And not only are you looking at their training, you're looking at their personality. Do I fit with this person? Does that person answer the questions that I need answered? Does that person speak to me in a way that I can understand? Is that person available to me if I need them for something? That can go a long way to helping relieve some of the anxiety associated with surgery. I think friends and relatives who've had experiences with various people can be a good resource as well. Now remember, everybody's an individual and every circumstance is a little bit different, so you can't hold everyone to the exact same standard as far as their interaction. But by and large, if a group of your friends or church members or relatives have been to Dr. X and they had a good experience, they felt like they were well taken care of, they felt like they got a good result, that's good information. In a similar way, you can also talk to your friends and relatives about bad experiences. For example, in spine. So if I recommend somebody to have a spine fusion, you can talk to your friends and relatives and whatnot about spine fusion. Have you had a spine fusion? Yeah. Who did you use? Dr. Y. How was your experience? I really had a problem. I got an infection. I never seemed to get them on the phone. He cut me loose and never really listened to me. Well, that's something to think about. Now remember, a one-off doesn't necessarily mean that that's a pattern, but if you talk to several people, and in a community Nashville size or surrounding, there's a lot of people out there that have been taken care of by a variety of folks. You can start finding patterns. It's good to listen to. You can talk to the Tennessee Medical Association. That's a group that is basically a physician-based group, and you can ask them, have there been complaints about X surgeon, Y surgeon, to find out if there's been any issues. It does take a little bit of work, but you can find information. There's a national data bank about physician lawsuits. Now, that's a nationally accessible data bank. There may be some restrictions on who can get access to all the fine detail, but you can look up physicians and find out if they've been subject to a number of lawsuits. Now, caution about that. A lawsuit does not necessarily mean that the physician is a bad physician. A lawsuit is one party who feels harmed or otherwise negatively impacted by another party. And some of those lawsuits are not based on technical skill. Some of them are based in dissatisfaction. Some of them are based in complications that are normal facets of surgery that can happen. So we have to be a little bit careful about saying, okay, well, this guy had a lawsuit, therefore he must be a bad doctor. Statistics show that if you're in practice long enough, particularly in orthopedic surgery and especially in spine surgery and neurosurgery, you will be sued by one or more people during your career. It's just part of the process. It doesn't mean that we take that lightly. And in fact, when a surgeon is served with a lawsuit, whether it goes anywhere or not, it can be pretty devastating for that surgeon emotionally, because every surgeon that I know, but most surgeons in general, take it very seriously. Their responsibilities are very serious. And we do everything we can to do the best thing possible for the patient. And it doesn't always work out that way. And so I've had a lawsuit brought against me. It wrecked me emotionally. Now, the good news is the lawsuit has been dropped, but still it changed me forever. It makes me think about myself. It makes me wonder, am I good enough? It makes me judge myself with regard to, is there a problem in the way I do things or not? I've learned from that, but it took its toll. And so we, in general, take that very seriously. But if somebody has lawsuit after lawsuit after lawsuit, and it seems to be similar types of problems, patients unhappy, complications that are the same, devastating bad outcomes, deaths, things like that, that's something that a pattern sometimes is something to listen to, okay? And then you can talk to other people. Now, in this world of employer-based insurance, many people actually have access to their HR department. And if the company's large enough and they've been around long enough, the HR department may actually have some information about various physicians that they've had dealings with to try to help people's problems. A lot of people have workers' compensation injuries in manufacturing and things like that. And companies work with people like me to try to help their employees. They have experience and they know, in many cases, who is communicative, who is has problems, and whatnot. So that's another resource. Unfortunately, there is not, as I said when we started, there's not an easy way to assure yourself that that person is qualified and good at what they do. It's really taking all this other information and putting it together. In closing, one of the things I always tell my patients is, particularly if we're talking about surgery and big surgery, is I almost always tell them, you will not hurt my feelings if you ask for another opinion. Second opinions, we recommend second opinions all the time, simply because not every surgeon has all the answers and not every surgeon thinks exactly the same. In spine in particular, there's multiple ways of skinning the same cat. And so I don't have the arrogance to say I know everything. And if somebody's concerned, if they're nervous, if they're not sure, seeking out a second opinion to help them gather more information is a good idea. The good news about musculoskeletal care and spine care is rarely is it something that's emergent, and rarely is it something that it's life-threatening. So you have the ability to get information from other people. In addition, I am a big believer in the gut feeling, okay? Somebody comes in and they have a gut feeling. They just don't feel right about whatever we're proposing. That's okay. You're not going to make a wrong decision. Whatever decision you make will be right for you at that time with the information you have. There is no ability to have only one decision be made. It's right for the moment. I've literally had patients who have come to the hospital to have their surgery. They're in their gown, they've got their IV in. I come to talk to them before surgery, and they say, you know, doc, something just feels wrong. I'm nervous, I'm scared. I don't think that, I'm worried about this. And after discussing things with them, if we can't alleviate their fears, and they say, you know what, I don't think this is the right time, I say, you're not hurting my feelings. We haven't done anything to harm you. Listen to your gut. If you decide something else, we can come back at another time, but there's no forcing anybody to do that. The challenge with the super extreme Dr. Dunch is the narcissist and sociopath are also extremely persuasive, and they can basically talk people into just about anything. If you feel like you're being pushed in a corner or being forced to do something, in this situation, my situation in particular, spine, with fear or other anxiety-provoking things, listen to your gut. Nobody should be forcing anybody into anything. Again, there are very few circumstances in orthopedic, musculoskeletal, spine surgery that is life or death or is emergent. There are some things, but most things, it's completely what we call elective, which means you can choose to do the operation or not. You can make the choice. So bottom line is, if it comes down to the primitive, I have a bad feeling about this, that's okay. Listen to it. Get your information. Many times the bad feeling is not based on any really reality, it's just anxiety. Once you get your information, okay, I'm good with this now, let's go ahead. And you can go on and have a good experience. Anyway, so I encourage you to look up where you get your podcasts, Dr. Death by the producer Wondery, or if you have Peacock streaming, I'm not sure it's on the free version, it's probably on the paid version. Look up Dr. Death on Peacock. There was some artistic license done. Some of the facts aren't quite correct. Some of the details and timelines are not really accurate. But it's a very good depiction about what that problem was. It's a fascinating story. It's a heart-wrenching story. It's a sickening story in many ways. But rest assured that that type of individual is super, super rare. Okay? Don't be like my partner's patient and base your fears on that type of hen's tooth, if you will. For the young people, that means really, really rare. Rare as hen's teeth. People my age understand that. But anyway, take that information, but digest it in your brain and your gut to gather your information and make a good decision. Anyway, so that's it for today. Little weird story, little interesting. I encourage you to look up Dr. Death. If you like true crime stories, it's phenomenal. It's also sickening. The podcast is well done. And I encourage you to at least listen to it. Anyway, that's it for today. If you have any comments, if you have any questions, hit the comment button below. I'll try to answer those for you. Casey, we're not here next week, correct?
Correct.
Because I'm out of town.
But then we'll be back.
And who will we be back with? Do you remember?
I think just you.
Okay, it's just me. If you have any ideas for a...
Dr. Shepard, I like.
Oh, good.
Yeah.
So this is actually really exciting. So Dr. Nick Shepard, is going to be with us in a couple of weeks. Nick is a brand new surgeon with TOA. He's a spine surgeon. He's practicing in Rutherford County, so he'll be in Murfreesboro and Smyrna. Don't know exactly the topic, but I look forward to introducing you to him. He's a super nice guy, really well trained, has a good head on his shoulders. He's brand new in practice, so we're going to be helping him along. I'm one of the people who's trying to help mentor him, to help develop his practice and have a long career. Great guy. Look forward to talking to him further, and we'll get you out with a topic coming up so we can give you some warning. Anyway, that's it. TOA.com is your resource for musculoskeletal care in Middle Tennessee. I know there are how do you put it? Not wannabes is a little hard. There are copycats out there that are trying to give you information and try to ride our coattails a little bit. Go to TOA.com. We can teach you what you need to know, and we're here for you to try to improve your overall health, your lifestyle, and get you back in the game. So go out there, live your best life. Have a great weekend. I'll see you in 2 weeks.